Hey everybody, welcome back to another episode of Ask Kati Anything. I'm your host, licensed marriage and family therapist, Kati Morton. I'm so glad that you're here. Today's episode is all about OCD and anxiety. More specifically, we're going to dive into what compulsions really are, whether our intrusive thoughts can pop up in our dreams or not. Why does that happen? Also, what causes us to develop OCD and how to better manage the physical symptoms of anxiety and OCD as a whole. Without further ado, let's jump into this first question. This question says, Kati, is it possible that my self-harm and self-sabotaging behaviors are compulsions? I usually tell myself I'm not deserving of help or nothing is actually wrong unless I engage in X behavior. So then I engage in the behavior and feel almost like I self-validated. But also I feel too ashamed to talk about it and guilty because if that was my thought, then is this even real? And can't I just stop? And then the cycle continues. It's like I want to stop, but I can't because then I think I'm not worthy of getting help, but I can't even get help because I think I'm making it all up anyway. It doesn't make any sense, but I don't know why I keep getting stuck in this cycle and I don't know how to get out. Now there's another comment on this, but let's get right into it. Now, compulsions themselves are the thing that we do when it comes to OCD, which stands for obsessive compulsive disorder. Compulsions are the things that we do to assuage the anxiety or lessen the anxiety that we feel due to our obsessions. Okay, now let me explain a little further. When we have OCD, we have a lot of things we worry about, we obsess over. It could be cleanliness, but that's actually not the most common. The most common is actually checking. And that means checking that I locked the door, checking that I turned the stove off, checking that I fed the dog, checking. We can do that, and we can even feel like we have to do it a certain number of times. So those are our obsessions. We worry and think about these things. Then, let's say I am worried. Hey, did I shut the back door? Did I lock the back door? Did I lock? And it goes and goes and goes. My anxiety builds until I do the compulsion, which is I go and check that door 8 times to make sure that it's locked. And once I've done that, my anxiety goes down and then it can build again, right? So that's how that works. Therefore, understanding that that's how OCD operates, when it comes to self-harm and self-sabotaging behaviors, those themselves are not compulsions because they don't relieve the anxiety or the buildup that you feel. There's no obsessions here. It's essentially that you tell yourself you're not deserving of help and then you don't end up getting help. This is what I would call self-sabotage. Like you said it yourself. But even your self-injury, those are it could be ways that you cope. Self-harm, I find, can be something that we do to help ourselves better manage how we feel or express how we feel better, or possibly give us another opportunity to show ourselves the care and love we didn't get. I mean, there can be a ton of reasons behind it. Those are just some of the ones that I'm the most familiar with and that my members of our community, as well as my other patients, have told me over the years. But when you're talking about how you engage in the behavior, even though you're saying like, I'm not deserving of help or nothing's actually wrong. And then unless I do it this many times and then I do it. And then, so that is you sabotaging. If it was a compulsion, it would be more like my anxiety builds because I need to check this, or I need to make sure this is okay, or I need to clean this, or I need to do this thing a certain number of times. And I will feel anxious and overwhelmed. I'm so worried about what will happen if I don't do this thing, until I do it. And then I feel a little bit better. So it sounds like instead yours is more of that sabotaging behavior, and the self-injury, I think, kind of is your way of maybe coping with something, or like I said, there's other reasons for it. But that's really where it comes from. And getting stuck in that cycle, I don't know if you're seeing a therapist, because it sounds like you are going back and forth between whether or not you're deserving of help, which is very normal, unfortunately. But please reach out to a therapist and let them know this is what you're struggling with, that you struggle with self-sabotage because you believe, you're not deserving of help, or you're not bad enough, and this, and then we end up trying to make it worse, and then we feel like it's even faked, and it's like this cycle we can't get out of. It's incredibly common, so don't think that anything's wrong with you for dealing with this. Getting the right support and understanding where that comes from is going to really be your path out. And a lot of times, just so you know, self-sabotage like this can come from some shame, thoughts and beliefs. It could come out of trauma, but not always. But it can come from like the shame, embarrassment, and guilt, or even just a low self-esteem or lack of like confidence in ourselves, we can feel like there's always other people who are more deserving than us. And that can lead us to, essentially harming our own progress as a way to hold ourselves back, almost prove ourselves right. And especially when it comes to doing like harming ourselves more to try to prove, or quote unquote prove, that we are worthy of help or are deserving of care. It can sometimes be what I call it like silent screaming, where it's like I'm trying to show, it's almost like our brain and body are in a battle, where our brain's like, you're not sick enough. And our body's like, or, another part of ourselves like, yes, I am. Look, like we're trying to prove it to ourselves, which as a therapist always makes me wonder if maybe in our life we had someone like a parent or a caregiver who was more neglectful or maybe emotionally absent. And so it's almost like we're always trying to prove to them that we're worth it. Like, see me? Do you see me? Because we never felt seen, heard, or understood. And that's so vital growing up. And so this could be your way of trying to get that. I'm throwing out a lot of options, but I just want you to know that it's very common. We can, once we figure out kind of where we think it's coming from, we can find our way out, and we can come up with better ways to manage anxiety or concern, embarrassment, or shame. We can find better ways to deal with those experiences rather than sabotaging or harming ourselves. Okay. There's a comment on this that says, I agree with this question so much. Self-harm, and before that, over-exercising and restricting just felt like a routine. I used to self-harm X times a day, always at the same times, in the same places, and to a similar degree. It didn't seem to have a reason behind it. And after about 2 months, I told myself I wasn't allowed to do it anymore. And I was able to mostly stop. I'm very confused why this might be happening, as a similar thing happened with my eating disorder after I started at a treatment center where I just started eating again. I've also struggled with the thoughts that if I don't do it, I don't deserve help. And I'm just causing my own problems, so I don't deserve help anyway. Any advice on how to deal with this would be great. Thank you. Of course, in this case, it sounds like we're trading. We're in a trading game. We've traded self-harm and then over-exercising, then restricting. I'm curious what we're using now, or if others have flared up as a result. Now, you said you went to treatment, so I don't know if there was actual therapeutic support and help at that treatment center, which I would hope that there was. And that could be why we're able to better manage the urges, I guess, or mitigate the impulses to act out in self-injurious or eating disorder type ways. But if we didn't feel like it was that therapeutic for us, then it could be this trading. Remember, self-injury and eating disorders are coping skills for bigger things going on. It's essentially our brain and body's way of saying, hey, I don't have the skills or tools to deal with this or to manage this. So I'm going to use what I've got. And you know what I can control? You know what I can do? I can do things to myself. I can control myself. And so that's where our self-injurious urges come from. That's where eating disorder behaviors come from, like over-exercising, binging, purging, restricting, whatever. All of that can come out of it, because even though it's actually very out of control and very self-destructive, in the moment it feels like, oh, I've got control over my life again. Or, oh, I can finally express that thing that I don't have words for, right? And so they're coping skills, and we trade them. And that's why I always talk about self-injury and eating disorders happening so often together. And when one gets better, like, oh, I'm not, let's say, binging as much, our self-injurious urges go up through the roof, and then vice versa. If our self-injurious urges go down, our eating disorder can thrive. And I've had patients who are like, I'm not doing either of them. And I'm like, but you're running a lot. So I'd be like, over-exercise, or, oh, you're spending a lot. Or we could be doing all sorts of things, having wild sexual relations that in a very harmful way. We could be engaging in relationships that aren't helpful for us. It sounds very bizarre to talk about quote unquote coping skills like this. We could be drinking alcohol in excess or using drugs. It's just using something else to focus on, something to numb out, instead of managing or actually acknowledging the pain that we feel. And so it's very common for it to be like a trading game because don't worry, it won't be like this forever, but until we figure out what the root of that issue is. So if we have different coping skills, like let's say self-injurious behavior, we also struggle with alcohol addiction, we have eating disorder type behaviors and over-exercise, and maybe a little shopping addiction or gambling or sex addiction. We have all these things going on. And we trade, oh, I got the self-injury under control. Oh, it feels like the shopping's gone up. And oh, my eating disorder behaviors are gone up as I got control of the shopping. We switch around over and over until we figure out, hey, the reason that I'm trying to cope so much and numb out so much with all these not helpful behaviors is because of childhood abuse, was because of bullying that I sustained all through school, was because of the fact that I was neglected as a child. That is abuse, but I'm just giving other examples. We have to figure out what the root is for us. Where is it coming from? What is the real pain that we're experiencing? Maybe we use these coping skills because in our family, no one ever talked about emotions and never expressed anything. So we don't know how else to do it. We don't have any other skills. Whatever the root of it, we can figure out what that is. We can work to heal that trauma, work with a trauma specialist. We can better process through the bullying and the trauma with that. We can find how to nurture our inner child. We can work on effective communication skills and ways to express ourselves more thoroughly. We can do all of those things depending on what our issue is. And then the urge to use those unhealthy coping skills will go away. We will have to fight to replace them with healthy ones, which I know are not as good in the moment. And it can take sometimes 5 of these healthy ones to replace the one unhealthy one, but stick with it because it can and will get better. So just figure out what that root is. That's where our work begins. And trust me when I tell you that you can work your way out of it, okay? Moving on to question number 2. This question says, hi, Kati, can harm or sexual-based OCD intrusive thoughts come up in dreams? I had a very horrible sexual-based dream, and now I'm feeling so much shame. Like, what if I like that? What if I'm actually a horrible person? Now, there's an add-on to this, but let's just jump right in. Intrusive thoughts are interesting. For anybody who doesn't understand what intrusive thoughts are, they are part of OCD as a whole, and they essentially come out of nowhere, and they tend to be violent or sexual in nature. And they feel ego dystonic, meaning we don't like them. They don't feel like they are who we believe ourselves to be. And they feel, for lack of a better term, kind of icky. Like this person, like I have shame about this. Like, what if I like this? Oh my God. And while there isn't a ton of research, I tried to Google some things about intrusive thoughts and OCD. There isn't a ton about it being specific to dreams. But what we know about dreams is that it's often a time for our brain to process through our day and to process through different things that are happening. And it can take things from like an old experience and try to process them. That's why they can feel really jumbled. And you're like, why is that person here? And it's possibly because you didn't sleep well the night after that event happened with them 15 years ago, right? There's a lot that can happen in our dreams. And because intrusive thoughts, I would assume, are part of your day, there's nothing to say that they couldn't also find themselves happening in your dreams as well. Does that make sense? It's almost like because it is part of our day, it could wind up in our dreams too. I also want you to know that dreams are not indicative. Even the term dreams maybe isn't quite the correct term sometimes, like what happened when we were sleeping, right? Dreams are not always indicative of the things that we want or the things we quote unquote dream about, right? It's not something that we always like. I've had all sorts of different dreams, things with, that can be violent, like someone trying to break into my house, and I always try to lock the door and I can never get there in time. And then I wake up in a panic, right? There's been people in my dreams I don't know, people like in situations and instances where I don't act like myself. So do not think that your dreams are indicative of you as a person. I always like to think of them as kind of like our brain just cleaning house. And sometimes it stirs up some weird things that like, oh, I don't know what that's from. And it gets mixed up and it gets shuffled off. And so that could be it getting sloughed off as like, hey, there were, I've had intrusive thoughts in my day. I don't like them. They've shown up here as well. I know that's kind of a roundabout answer, but that's really the truth. There isn't a ton of research about intrusive thoughts specific to dreams, but because they happen in our real life, they can happen in our dreams. And again, dreams are not indicative of how we feel, what we think, and really truly who we are. They're like bits and pieces of our life and other things we've encountered and other people we've encountered, and they're not the same, okay? I know we talk about dreams as if like they're the things that we strive for and that we dream a dream. And so my dreams are filled with all the hopes that I have for the future. That's really not what they are. They're more, kind of random and thrown together, and they're nonsensical in a lot of ways. And there's a lot of different hypotheses about what they mean. And so don't read too much into this. Do not think that these, kind of sexual based dreams are things that you want, things that you like. They can feel like intrusive thoughts. They can be ego dystonic. And that's no reflection on you. You're not a horrible person. Frankly, your brain is trying to process through possibly some of the OCD symptoms that you experience while you're awake. And so it's doing the best it can. And it's not indicative of how you truly are and what you really want. Okay? There's a comment on this as an add-on. Is the same true for agoraphobia? I dream of getting kidnapped if I go outside or when I'm too loud at home alone. However, I was also diagnosed with OCD, and my compulsions of checking locks is also related to the same fear. It sounds like that's all connected. And for those who aren't aware, agoraphobia is an anxiety disorder, okay? It involves an intense fear of being in places or situations where it could be impossible or really difficult for us to get out of it without embarrassing ourselves, without, maybe getting harmed. And so we don't usually like to travel. We don't like to be in crowded places. We don't like to sometimes be outside at all. And so it can cause us to feel very, very anxious, very stressed, almost like a panic attack when we do go out in public, when we are forced into these situations. And so for this person's question, when they said, is the same true for agoraphobia? They dream of being kidnapped when I go outside. Our mental illness that affects us during our day could definitely affect our dreams at night. Because if our agoraphobia is really acting up, we have a ton of symptoms, we're very afraid of having to leave, maybe we had to leave our house that day, then having that dream of getting kidnapped when you go outside could definitely be tied to that. Again, our brain when we're sleeping is trying to do its best to process through and make sense of the things that occurred during our day. And so if you're having those concerns during the day and you're worried about leaving and what that could do for you, of course you could have dreams like that, right? I'm sure your brain, when it's fueled on fear, can think of things like that. And also having OCD as well, the compulsions of checking locks is also, again, to like assuage that anxiety, to try to bring that anxiety down. And so that's probably like you said, just one of your compulsions. The worry is that someone's going to break in or someone's going to harm us. And so the compulsion is that we will check the locks and make sure that we're safe. So yes, I could see that being the same. It's very normal for things that happen in our life to come up in our dreams. I feel like that's kind of the purpose of dreams as a whole. Okay? And let your therapist know this is happening. Let them know you're experiencing this. There are different medications we can take to assist with, trauma dreams and difficulty sleeping. If you're not sleeping as a result, let them know. But also let them know these things are coming up in the dreams. And this is like a theme throughout the dreams. Because we want to track that. We want to make sure that as we process through or manage our OCD, that goes down. And so make them aware that you're experiencing this and they can let you know if there's something else that might be beneficial for you and as part of your treatment plan. Okay? Moving into question number 3. This question says, hi, Kati. I had really bad and obvious OCD when I was younger. I think roughly from the ages of 5 years old. I didn't have any traumatic event happening to me. Why would a child this young develop OCD? This is a great question. Why would a child this young develop OCD? The truth about mental illness as a whole is that genetics play a huge role, meaning that people in our family probably have other anxiety disorders. I remember, this has probably been like 10 years ago, maybe 15 years ago. So I'm 41 now, so you do the math. Around that time, I realized that my grandma, being a worrywart, she was always a worrier. Like, if we legitimately lived on the same property pretty much. We just lived down the street from her growing up. And when we would leave after having dinner with them, she'd be like, call me and let me know you made it home. And then we would forget because you do. And about a half hour later, she'd call and she'd be like, oh, good, I'm glad you're home. I was worried about you. And I'm like, Grandma, we legitimately drove like a quarter mile. So, I realized as I was older when she went to see her doctor and he had told her that maybe she had anxiety. And so, of course, she was telling me because I'm a therapist in the family. And she's like, what does this mean, sis? That's what my family calls me, as sis. And I realized how prevalent anxiety is in my family because I know that my mom already has it. My grandma's telling me she has it. My other aunt had told me she had it later that year. Genetics play a huge role in our mental illness. It's not the only deciding factor, But if we have multiple people in our family who have it, the likelihood is pretty high. Like it can go from, let's say, 5% of the population. Let's say we're talking about anxiety. I forget the exact percentage, but let's just say 5% for nice, easy numbers. And then if people in our family have it, maybe it goes up to 20%. That's a huge difference, right? And so that's important. So what could cause a child that young to have OCD? There could be genetic factors. So if you have a first degree relative, like your mother, your father, that could be why. There's also, they found, and I'm just reading because I did some research for you. There are also abnormalities in the way that our brain's formed. It doesn't mean you're like deformed. That's not what I'm saying. I'm just saying that when we have OCD, our prefrontal cortex and subcortical structures, they control kind of like our emotion regulation and our behavior. So how much control we have over ourselves could be like the adult part of our brain, kind of. Some people with OCD, they find, can have, like areas of high brain activity and low serotonin levels. So it can mean that it can cause that kind of up and down of OCD where we feel this obsession and we really, really worry, oh my God, oh my God, oh my God. And then we do the thing and we feel a little bit better. So they find there are some differences in our brain function as well as in certain areas and regions of the brain. So that could be part of it. Then there's also environment. Now, if we're really young and we develop OCD from a young age, it could mean that growing up, everyone around us, this also could play into genetics too, if everyone around us acted out in anxious or OCD-like ways, meaning utilizing, their compulsions, expressing their obsessions, showing, maybe they had panic attacks and talked about things about it, like with regard to it, right? That could all lend itself to it as well. And so if we're around people who are super anxious, or we have somebody in our family who has a really strong sense of responsibility and they're always like talking about it and acting out on it and seeming really overwhelmed, we can pick up on that. And that can cause us to develop OCD-like symptoms ourselves. We also, and there was some research, and this I didn't get to read a ton about, other than the fact that there was a correlation between children who may develop OCD with a streptococcal infection. So if we get strep throat, that's what streptococcal is. If you get strep throat at a young age, they report a connection between strep throat and OCD. Now, why? I don't know. But as someone who had strep throat a ton as a kid, I can tell you I definitely had some OCD tendencies. And so that was really fascinating for me to read. So thank you for asking this question. But essentially, there are certain infections we can get at a young age that can increase, for whatever reason, our propensity for certain mental illnesses, in this case being OCD. Now, there's also personality traits, and that I don't really put as much stock in, because I believe there's the environment and genetics that all can play a role in our personality. But if we find ourselves to be more of a type A structured or rigid individual, being really methodological about how we do things, they also see a strong correlation between those attributes and OCD. So overall, the fact that you had this roughly at the age of 5 years old with no traumatic event, those are some of the reasons. But when I read this, my gut reaction, no research to support this, just my own personal experience with my patients and even in my own life, is that I'm wondering if, I know you said there's no traumatic event, was there an adjustment? Because when we're little, so 5 years old, very young, things can feel out of control very quickly because we don't have a ton of agency over our life. Meaning we don't get to decide where we live. We don't get to decide if our parents stay together or get divorced. We don't get to decide what school we go to or who our classmates are. There's a lot of things that are out of our control, right? If things don't feel good to us, they feel very chaotic, very out of control, trauma or not, right? We can try to develop some sense of control, try to take that control back. And OCD can do that for us sometimes, because remember, that anxiety builds. We do the thing, we feel a little bit better. If we're doing things in a certain order or method, we do it just so, that rigidity can help us feel, quote unquote, under control. And so that could be a piece of it as well. I don't know what was happening when you were 5. I don't know if you'd moved schools recently. Did you have a new sibling introduced into the family? The adjustment can be very rough for the older siblings. Were your parents getting divorced, or did they fight at all? Like, I know when we talk about traumatic events, we often think, oh, that's a big word. Like, that has to mean this big thing happened. There's a lot of ways that we can struggle. We can have a difficult time coping, especially when we're that young. So those are some of the reasons I think that a young child could develop OCD or OCD-like symptoms, because I don't even know if you can actually diagnose it at the age of 5. Usually, children getting diagnoses is something we like try to hold off on and see if it's a developmental thing, or if maybe I hate this term, but like quote unquote grow out of it, meaning like maybe the situation fixes itself, because they worry about giving someone a diagnosis when they're little and having that like follow you throughout your life. So just keeping that in mind. I do not believe we grow out of our mental illnesses, by the way, but I'm just saying that sometimes they won't allow for a diagnosis to be given to someone that young. I hope that helps answer. It was really fascinating to read about, so thank you for asking this question. Moving on to question number 4. This person says, Kati, could you talk about harm OCD and OCD that would be helpful with intrusive thoughts? Now, I'm not familiar. I put this question up because I was so interested in like harm OCD. Now, that the way that I interpreted this, and if the person who asked this question, if I'm incorrect, please feel free to ask a question again with some clarity. But harm OCD, as far as I understand it, is essentially when our OCD, mainly our compulsions, have to do with harmful behavior. Now, that would mean that it's in some way hurting us. Now, I don't find that to be that common. I find self-injury to often, like we said with the first question that was asked, like it's kind of a separate thing. It's like a different type of coping skill. But I could see there being some overlap, especially I know for my pure OCD folks, meaning we spend a lot of time in obsession land, like worrying, and then there's mental compulsions that we do to assuage the anxiety. I know that the symptoms and the ways that OCD can affect us can be very harmful. So I'm not sure if that's what this person was saying. But when it comes to the harmful piece, that's how I understand it. And let me know if there's more clarification that you could offer, because that's really all that I know. And maybe I'm ignorant and I'd love to learn something new, so you just let me know. But when it comes to how we can help with intrusive thoughts, now I'm assuming this person maybe is saying like, oh, I self-injure or harm myself as a way to manage intrusive thoughts. And I'm here to tell you that intrusive thoughts are born out of that anxiety piece, that build, what I would call kind of like the beginning of that mountain of obsession. And they come out of nowhere. But if we are able to treat the anxiety, whether that's through medication or whether that's through cognitive behavioral therapy or other type of therapeutic modality, we can get that anxiety lessened so that the intrusive thoughts don't happen with such frequency. Because sometimes they can feel like they're constant, and it's like it almost impedes our ability to live our life and do what we need to do. And if that's the case, we do need more treatment, whether that means more therapy, more medication, some medication on board, whatever. But I do not think that like harming ourselves is actually going to help that go away. But for anybody who struggles with self-injury urges, that oftentimes we utilize that as a way to numb out from something uncomfortable, and intrusive thoughts are really uncomfortable, right? And so maybe that's kind of why it's playing into this. But I would let your therapist know that you're struggling with intrusive thoughts. Let's try to come up with some other ways to better manage. There are 2 that I have heard from you and my other patients that have been effective, but if there are others, let us know in the comments. We can always share in each other's knowledge, right? That there are 2 ways that we kind of can best manage intrusive thoughts. Number 1 is distract like a motherfucker. If intrusive thoughts are just constant, it feels like they're bothering you, they're in the way of your day all the time, let's do something else. Let's distract with something else. Do something that keeps your mind busy enough that they don't happen, or at least happen as often. Journaling could help. Maybe playing a video game could help. Maybe, walking our dog or talking with a good friend. Those are all potential ways to distract ourselves. Now, the other is checking in, acknowledging them, and calling them what they are. Because the thing about thoughts that's very interesting is that thoughts happen all the time, and we don't have to validate them or engage with them. A thought can come in and we can be like, oh, that's interesting, or like, what the fuck, right? Intrusive thoughts are like that. You're like, what? And then we can say, that's a weird thought. What a stupid, silly, intrusive thought. I don't want to engage with that at all. I have no feelings about that. I don't want to because it's just a random thought. Because thoughts are not facts, right? And having a thought multiple times doesn't make it true. And just because it pops out of nowhere doesn't mean it speaks to who we are, right? Intrusive thoughts are ego dystonic. We don't like them. And so between those two kind of coping skills, and if anybody leaves any in the comments, that could be helpful too, that should help us better manage so that because I'm not sure exactly how this question, what the person was really asking, but if we are using self-injury as a way to manage our intrusive thoughts, then hopefully those are better, healthier ways to cope. Or if we find our OCD itself to be kind of like filled with harm, I hope, again, we're finding better ways to manage the anxiety that comes along with OCD as a whole, so that hopefully those urges will go down. But keep me posted, okay? Final question. Let's move on to question number 5. It says, "Hi, Kati. I hope you're doing well." I am. I hope you're doing well. Could you talk a bit about physical anxiety? I struggle with anxiety and I feel it super physical. For example, I am dissociating a lot, heart racing, nausea, and my stomach is upset. I've learned coping skills in therapy on how to deal with anxiety, but just like the physical part of it, I just feel like the physical part of it is not getting better. I've also tried more physical exercises and stuff like that to release the physical energy. I feel physically anxious 24/7, even if there's no reason to be. I'm not taking any medication. I've tried it in the past, but they made me dissociate so much more. Do you have any advice for me? Thank you so much for your help. Of course. There's a couple of things. Now, you've done some exercises to try to release the energy. That's great. Stomping out and shaking out, that can be helpful, but it sounds like it's not quite working. I wonder if cold water, like ice plunge, I know those are like popular for whatever reason, for inflammation, or maybe just because people are like into quote unquote fitness, right? But it does help those of us with anxiety and with dissociation and other mental health struggles. I think ice plunges could be incredibly helpful. Now, you don't have to go buy an ice plunge, whatever. You can take an extremely cold shower. You can fill your tub up with cold water, throw some ice in there and do it that way. There are a lot of ways we can do it without buying anything. So give that a try. Also, because you dissociate a lot, I'm curious if any grounding techniques have worked for you. Some of those could be things like looking around the room for things that start with the letter A and the letter B and going through the alphabet. We can look and count colors, like how many things in the room are blue or brown or green. Those are all ways that we can try to keep ourselves present so that we don't dissociate. But I am interested about the medication making you dissociate so much more. I would let your psychiatrist know, and I'd talk to your therapist about it, because ideally it should make you feel less anxious, and therefore the urge to dissociate would go down. So that's very interesting to me. I would want to tell them about it, because maybe we can try a different type of medication. Like, for example, let's say you were on an SSRI or a selective serotonin reuptake inhibitor. Maybe instead we try like an atypical, or we try an SSNRI, just a different type of antidepressant, because there's 2 types in there. So anyway, just something to think about, because that's very interesting to me. I also wonder if any vagus nerve stimulation stuff, like the ice bath, does help that. You can also just dunk your face in cold water, and that triggers the diving reflex, which stimulates our vagus nerve. I have an older video. If you just get on YouTube and look up vagus nerve, Kati Morton, it should come up. But you can like massage it. You can like suck on sucky candies. There are tons of ways to trigger our vagus nerve. It's our longest cranial nerve. I think it's the 10th cranial nerve in our body. And it can help calm us down. Yeah, we have to find some ways to better soothe your system, because what you're doing is not working. I also, as a last piece of advice, would want you to consider potentially trying out some sort of somatic experiencing type of therapy. If your therapist offers it, amazing. If they don't, see if they'll be open to working on it with you. If there's somebody in your area that does it, amazing. You could also find someone who does like trauma-informed yoga, or other types of stretching and things like that. That usually means that it's somatic. Those could also be ways for you to try to kind of get out the physicality of your anxiety. But hopefully one of those works and helps soothe your system a little bit. A comment on this says, I definitely relate to this question. In addition, I often feel the physical symptoms of anxiety, but I don't even know what I'm anxious about. Anxiety can be like that. We'll talk about this. My physical symptoms make me not want to do anything social, because I often get GI issues and nausea, and then I end up isolating. How can we minimize the physical symptoms? Now, anxiety can come out of nowhere. it doesn't always have a trigger. I mean, technically you could say, yes, it does have a trigger somewhere in there. We have some kind of low self-esteem or some kind of issue here. Yes, but we aren't aware of it. Anxious thoughts more often than not feel like they come out of nowhere. Why am I so worried about this? We don't even know why we're thinking that way. Why would my brain do that to me, right? It can feel very, going back to like ego dystonic, anxious thoughts often feel like that. We're like, what the heck, right? You don't even know what you're anxious about. That's incredibly common. We just feel anxious and we don't know. It's like when I lay in bed and my heart starts to race, I'm like, what gives? Body and brain. Come on, can we get on the same page, right? So I totally feel you there. The fact that your physical symptoms cause these issues, I understand that then it's hard to be out social or in social situations, but to mitigate the physical symptoms, we're going to have to find what works for your nervous system. And I would encourage both of the people who ask this question or anybody out there who's struggling to find some easy things that you can work into your routine that help you feel calmer. Now, the goal I learned a long time ago doesn't always have to be like safety or actually calm, but just take the edge off to lessen it. Because for some of us, feeling calm and relaxed and safe is triggering in and of itself. So whichever works for you, we need to find some way to take that edge off. Now, that could be an ice plunge. That could be finishing our shower with a blast of cold water where we're like, because that breathing in that I just did that, that's the diving reflex. That triggers our vagus nerve. Amazing, okay? One way to soothe our system. We can do a body shake. We can stomp our feet. Another way. We can also do like the grounding techniques and the things I talked about, the counting colors and the alphabet. Those are all different things that we can do to help us better manage. Because the truth about your anxiety causing these GI issues, this nausea, is that it's built up over time and we don't have any way to bring it, to take that edge off. So it just builds until we feel sick and then we're like, I'd rather just stay home. It's not worth it. And then we've proven to our brain and body that going out into social situations is anxiety provoking. And anxiety is one of those things that like, once it feels like it's proven a link, we have to break that link. It doesn't just go away. So we have to use like maybe do a body shake. Maybe we take a cold shower right before we get ready. We go out. Maybe we go out for a bit. We take a break, a breather. We go into the bathroom. We prove to our brain and body that being out does not have to mean anxiety. And it takes repetition. It's like exposure therapy, essentially, to disprove that. Breathing exercises can help. I don't like to offer them front because a lot of us are adverse to them, but they can really help if you can get one that works. The 4x4 breathing, you breathe in for 4, hold it for 4, breathe out for 4, and do it 4 times. We call that box breathing sometimes. You can do that. There are a ton of different things to try, but find what works for you so that we can help mitigate this. Maybe even keeping something on hand for nausea, like maybe you get a gum that has ginger in it. Ginger chews are really good for nausea. Or maybe we always drink seltzer water or ginger ale. Doing some things to help better manage, but preemptively finding something that will calm our system down so that we have those tools at the ready before we go out and before we engage with people and feel overwhelmed, right? We want to do it earlier on and not wait until we're feeling nauseous. Okay, I hope some of those are helpful. And like I said, if anybody has any tips or tricks themselves, please leave it in the comments down below. Thank you all so much for listening and watching. Thank you for sharing this podcast. Like I've mentioned, I'm doing more themed podcasts because it's like an easy way to really dive more into a topic. So if you see a question come up next week and you're like, it seems like there's a lot of conversation about this, then if you have a question about that specific topic, ask it because it's more likely to be chosen. Okay? Have a wonderful week. Take care of yourselves, do your homework, and I will see you next time.